Imagine this. A sudden, unexpected tightness grips your chest. Your heart races, your breath catches, and a wave of fear washes over you. Is it a heart attack? Your mind immediately jumps to the worst-case scenario, and the panic only seems to make the physical sensation worse. This terrifying experience is incredibly common, and if you felt it, you are far from alone. That sensation, often mimicking serious cardiac issues, is what we call anxiety chest tightness. It's a very real and often frightening physical manifestation of stress and anxiety, and understanding why it happens is the first step towards finding relief. Today, we're going to gently explore this phenomenon, demystify its origins, learn how to tell the difference between anxiety and something more serious, and most importantly, discover what truly helps. At its core, anxiety chest tightness is a direct result of your body's ancient fight-or-flight response. Think of it as your internal alarm system, designed to protect you from danger. When your brain perceives a threat, whether it's a real physical danger or a looming deadline, it doesn't always differentiate. It just pulls the alarm. When that alarm blares, a cascade of physiological changes kicks in. First, your body floods with stress hormones like adrenaline and cortisol. These powerful chemicals are designed to prepare you for immediate action, to run or to fight. Adrenaline, for instance, tells your heart to beat faster, pumping blood more rapidly to your muscles. This surge can create sensations of pressure or tightness right in your chest. Simultaneously, the muscles in your chest, shoulders, and neck tense up. This isn't just a minor discomfort. It can manifest as aching, sharp pains, or a persistent squeezing sensation. Imagine bracing yourself for impact. That's the kind of tension your body is experiencing. Even poor posture, often a byproduct of stress, can exacerbate this muscular tightness, making the chest discomfort more pronounced. Then there's your breathing. Anxiety often shifts your breathing pattern to something called hyperventilation, rapid, shallow breaths taken high up in the chest. This disrupts the delicate balance of oxygen and carbon dioxide in your body, leading to feelings of air hunger, dizziness, and that dreadful squeezing sensation in the chest. It's not always hyperventilation in the dramatic sense. Sometimes it's a more subtle, dysfunctional breathing pattern, characterized by abnormal rhythms that contribute to chest tightness, palpitations, and even lightheadedness, often without any strenuous exertion. Psychologically, chest tightness is a hallmark symptom in conditions like generalized anxiety disorder, or GAD, and it's a very common feature of panic attacks. Sometimes it can even occur as a limited symptom panic attack, where the chest tightness is the primary or even sole frightening symptom. What makes it even more complex is how anxiety can make you hypervigilant, intensely aware of normal bodily sensations. A benign muscle twitch or a slight pressure might be interpreted as a sign of serious illness, a phenomenon known as health anxiety, creating a truly vicious cycle of fear and physical discomfort. Now, it's absolutely crucial to talk about distinguishing anxiety-induced chest tightness from a heart attack. This is perhaps the biggest fear and the most important differentiation. Let me be very clear. If you experience new, severe, or persistent chest pain, please seek immediate medical attention. Always err on the side of caution. No script can replace a doctor's diagnosis. That being said, there are some common patterns. Anxiety-related chest pain is often described as sharp, stabbing, or fleeting. It can also be a dull ache, a feeling of fullness, a burning sensation, numbness, or even a heavy band squeezing around the chest. It typically remains localized in the center of the chest. It often has a clear link to stressors, and while acute episodes might subside within minutes, the discomfort can vary significantly in duration, sometimes lasting for minutes, hours, or even days. It can be accompanied by shortness of breath, heart palpitations, dizziness, stomach discomfort, sweating, or tingling in the fingers, all classic anxiety symptoms. Heart attack pain, on the other hand, is more commonly described as a heavy pressure or squeezing sensation that may radiate to the arms, neck, or jaw. It often occurs during physical exertion, though not exclusively. Again, if you're ever in doubt, get checked out. Once medical issues are ruled out, the journey to managing anxiety chest tightness becomes about understanding and action. For immediate relief, there are powerful techniques you can employ right now. First, try deep breathing exercises. Diaphragmatic breathing, where you breathe deep into your belly, or the 4-7-8 method, breathing in for 4 counts, holding for 7, and exhaling for 8, can activate your parasympathetic nervous system, your body's rest and digest system, which counteracts the fight or flight response. Next, practice relaxation techniques. Progressive muscle relaxation involves tensing and then consciously relaxing different muscle groups throughout your body. Mindfulness and grounding exercises can bring your focus back to the present moment, away from catastrophic thoughts. Light exercise, like a brisk walk or gentle stretching, can help release some of that trapped adrenaline and tension. Even just standing up and stretching your arms overhead can make a difference. Journaling can be incredibly helpful for understanding your worries and identifying triggers. And crucially, practice self-reassurance. Remind yourself that this sensation is temporary, that it's anxiety, and that you are safe. While immediate strategies are vital, true freedom from anxiety chest tightness often comes with long-term management. This involves addressing the root causes of your anxiety. Therapy, particularly cognitive behavioral therapy, or CBT, is highly effective. CBT helps you identify and restructure unhelpful thought patterns and behaviors that contribute to anxiety. Talk therapy can also provide a safe space to explore underlying stressors and develop coping mechanisms. In some frequent or severe cases, medication such as SSRIs or benzodiazepines may be prescribed by a doctor. This is a conversation you should always have with a qualified healthcare professional. Beyond clinical interventions, lifestyle adjustments play a huge role. Prioritize adequate sleep, engage in regular exercise, and consider reducing caffeine and alcohol intake, both of which can exacerbate anxiety. Work on identifying your personal stress triggers and establish calming relaxation routines, whether that's reading, listening to music, or spending time in nature. And never underestimate the power of social support. Connecting with others can provide immense comfort and perspective. You might be wondering why anxiety chest tightness seems to be getting more attention these days. It's certainly a trending topic, and for good reason. For one, anxiety is a highly prevalent cause of chest pain in emergency departments. Researchers like Dr. Kurt Kroenke and Dr. Paul Musi from the Reagan Streif Institute, alongside Dr. Amit Shah from Emory University, are actively investigating this link, with support from organizations like the Patient-Centered Outcomes Research Institute. This highlights a significant public health concern.
The "is it my heart or anxiety" dilemma is a huge source of public fear, underscoring the need for clear, accessible health messaging. There's also a recognized vicious cycle at play. Physical anxiety symptoms intensify anxiety and catastrophic thoughts, which then leads to focusing on physical illness rather than addressing the mental health component. Connecting to related health issues. Recent news also highlights the increasing focus on dysfunctional breathing, a condition often characterized by chest tightness and other anxiety-like symptoms. Researchers are also exploring shared physiological mechanisms in complex conditions like chronic fatigue syndrome, or ME/CFS, where dysfunctional breathing can also be present. Consulting pulmonologists for breathing issues is becoming increasingly recognized as important. Addressing controversies and debates. There are still some significant challenges and debates around anxiety chest tightness. A major one is the misdiagnosis and undertreatment of anxiety-related chest pain once cardiac issues are ruled out in emergency settings. This unfortunately leads to patient dissatisfaction, repeat emergency visits, and sometimes unnecessary tests. The "is it my heart or anxiety" dilemma persists as a primary source of fear for the general public, despite existing medical guidelines. And for individuals and professionals alike, breaking the vicious cycle of health anxiety, where physical symptoms fuel more catastrophic thoughts, remains a core challenge. Considering optimal treatment pathways. There's also ongoing discussion about the most effective and personalized treatment approaches, particularly how to best integrate medication and psychotherapy, both in the short and long term. And with the rise of technology, the evolving role of digital health solutions, like mindfulness apps, versus traditional therapy is an interesting point of discussion. Looking towards the future with optimism. Looking to the future, the outlook for managing anxiety chest tightness is hopeful and evolving. We anticipate improved diagnosis and care, with research actively seeking better options for patients in emergency departments to reduce misdiagnosis. There's a continuing push for clearer public education to help individuals better differentiate anxiety from cardiac pain, empowering them to navigate that "is it my heart or anxiety" dilemma with more confidence. Concluding with personalized treatment and broader context. The field will also likely see the development of even more effective and personalized treatment pathways, integrating various interventions. Technological integration with digital health solutions will undoubtedly play an expanding role as complementary tools for anxiety management. Finally, continued research into related conditions like dysfunctional breathing and chronic fatigue syndrome will shed more light on the complex interplay between our physical and psychological health, influencing how we approach anxiety-related symptoms moving forward. If you've experienced anxiety chest tightness, remember that you are not alone and it is not in your head. It is a real physical manifestation of a treatable condition. By understanding why it happens, learning to differentiate it, and actively engaging in management strategies, both immediate and long-term, you can regain control and find significant relief. Empower yourself with knowledge, practice self-compassion, and never hesitate to seek professional support. Your journey to a calmer, more comfortable life is absolutely possible.